Hey, Dr. Pound here with HealBetterFast, and today we're talking about what to do about a kink in the neck. Hey, Dr. Pound here with HealBetterFast, and today I want to talk about a common problem that I see in my clinic, and it's the common kink in the neck. So what causes a kink in the neck? And why do people develop them? And what can you do to prevent it? Let's get into it.
What's up with your neck?
What, you mean this?
Yeah.
I must have slept wrong. I just got a kink in my neck.
When I have patients come in with a common kink in the neck, oftentimes they'll feel like they have a pinched nerve, because that's exactly what it feels like. The muscles tighten up, you can't turn your head. It's pain that most people haven't had before, so it can be shocking or alarming, and it causes a lot of different symptoms. Sometimes you can have a headache, dizziness, sometimes the pain can be so bad you may even have nausea, you may even have tingling and numbness down the arm, and all of these things lead us to believe that we do have a pinched nerve in the neck. Oftentimes what I find is this is simply the result of a neurologic overreaction. And I know that sounds kind of technical for what's going on, and pinched nerve is so much easier to visualize. But many of the times we do imaging, we do tests, and we find out that what the person is experiencing isn't actually a true pinched nerve. There's nothing that's causing actual pressure on the nerve, but there's some sort of overstimulus. Now, our nervous system is very sensitive to potential spinal injuries, and for good reason too. It's one of the most important parts of our bodies, responsible for cellular communication over our entire system. Now, when I have people come in with this neck kink in the neck, oftentimes they want to know what caused the pain. When we think about looking down at our phones for long periods of time, can that actually cause an overreaction of the nervous system? Yes and no. Maybe someone who has an pre-existing injury can get this response, an illicit response from looking down for long periods of time, just like they would if they looked down at their kids for long periods of time, or they had their kids hanging on their neck. All of these things existed way before a phone did, and so we can't blame just the phone. But it does go back to posture and where our head is in relation to our shoulders. The longer periods our head is forward from the shoulders, the more stress or strain there will be on the lower discs of the neck. It's simple physics. For every inch forward our head comes from our shoulders, it adds about 10 pounds of pressure to the spine. But there are a lot of different causes of neck problems and neck pain that come way before just simply looking down for long periods of time. Some of these include degenerative disc disease, whiplash, arthritis, disc bulges, herniations, strains and sprains of the neck muscles, a true pinched nerve, or even more rarely, cancer, tumor, or even autoimmune diseases. So a kink in the neck may be out of the blue and may come across as not even something major, but very annoying and debilitating, but yet have a very serious problem behind it. And it can irritate people to the point where they actually are seeking out solutions. So some of the things we look for in neck pain is it localized? Does the pain radiate? Is there associated numbness and tingling? Does the pain vary in intensity? Does it go up and down? Does it ever go away? How long has it been going on? When I have patients come in with a kink in the neck, whether it be the first time, second time, or third time, we ask, is it a recurring problem? Does it happen on the same side? Does it happen on both sides? Typically, this kink in the neck will typically happen just one-sided. But what we're looking for is sensitization. That's the tendency for the nervous system to develop kind of a rut. Overstimulation or hypersensitivity to certain stimuli to be able to elicit a response. So in other words, if someone has an initial kink in the neck or neck pain, the initial may be shocking. If it's treated, it may go away and never happen again. However, if we see it does keep occurring and the root of the problem isn't being resolved, this can result in hypersensitivity or sensitization, where the body just says, okay, something's coming, something's gonna happen, we know it's coming, let's go ahead and spasm up the muscles so we can prevent the spine from being injured. We also see this more commonly in women than in men. Now, as far as research, we haven't figured out why, but they just tend to be more prone to kinks in the neck. What we also know is that there's not just one true cause, that the root of the problem may be a bundle of different things. So simply looking up the symptoms is not enough. You have to get an examination by a health professional who's dealt with this to be able to get to the real root of the problem. Now again, when we look at Eastern and Western medicine, they both agree that the sooner you do get examined and get intervention, the better off you'll be in the long run. So if you do have these symptoms, rather than trying to come up with a diagnosis and trying things on your own, make sure to seek out the healthcare professional as soon as possible if you really want to resolve this and not have this happen again. Otherwise, you are at risk for this sensitization, having this problem reoccur. Even though you may be able to get rid of the symptoms initially, the problem will probably come back, and if you're not addressing the root of the problem, it may develop even further and further and be harder to treat the longer you wait. The easiest way I can explain it, from my understanding, when someone comes in with a kink in the neck, it's similar to a jammed thumb or a stubbed toe, where the joint gets inflamed, the lining of the joint gets inflamed and irritated and swollen, and restricts range of motion. This swelling and inflammation can actually cause irritation to the nerve root, eliciting that muscle spasm that people have in the neck. And solving that problem is really simple to do as a chiropractor. That's one of the things I specialize in. And after 40,000 patient encounters, I can tell you with a certainty that if you go to a healthcare professional and get the pressure off that joint, typically you'll feel a lot better faster than just trying to wait it out, treat it, or risk having it happen over and over again. So if you or a loved one is dealing with this kink in the neck, if you're having common problems like this, seek out the care of a healthcare professional that can help with this problem, who specializes with this problem, to be able to solve it once and for all. So what's my take on kink of the neck? Well, again, when people come in, the joints in the neck can get swollen and jammed, and the lining, the synovial lining, can get irritated. This leads to inflammation in the joint and causing less movement in the joint. This can also lead, with the inflammation in that joint swelling up, to irritation of the nerve, sending inflammatory responses to the nerve, causing the nerve to feel like there's an injury in that area and cause spasm in the neck. The spasm in the neck can also lead to compression on the nerves, leading to numbness and tingling down the arm. But again, it doesn't mean you don't have one of these other problems that are even more serious. It just means you need to be checked out to see how you can heal better fast. So if you're looking to heal better fast, get evaluated by a professional, and if you're in the area, call me, 801-980-0002. I'd be happy to take a look and see if it's something that we can help with. I'm Dr. Pound, helping you heal better fast.